welfare, child protective services workforce. Yeah, I've been in, I actually started my career in 1979 as a investigator of child abuse and neglect cases in Amarillo, Texas, and then became a supervisor. At one point, started a child sex abuse unit. Actually, I didn't, I thought I had a difficult upbringing, but I didn't know that people actually sexually abused their children. So when I got the first case of that, I thought they were thinking I was a greenhorn. And they said, no, this is actually a real case, and you actually got to go out and investigate it. And sort of from that, started one of the first child sexual abuse teams in Texas. And then went on my career working in Massachusetts. And there used to be this commercial recruitment for Marines, and it say it's the toughest job you ever love. And for me, child welfare was the toughest job I ever loved. I loved it, and loved the mission, and loved the work. When I became commissioner in Massachusetts, people would say to me, you have the toughest job in the Commonwealth. Poor you. And say, I have the best job in the Commonwealth, lucky me. And, there were 40 days a year when I thought, maybe they might be right. This might be the toughest job in the Commonwealth. But, through my career, I've been a frontline caseworker, frontline supervisor, middle manager, and commissioner in child welfare. And had a chance to talk to thousands of kids, thousands of parents, thousands of social workers. And the common thing that they ask is, does anyone care? The families want to know, does anyone care how hard it is for me to be able to take care of my kids? The kids want to know, does anyone care that I'm out here struggling, that I'm feeling lost and alone? The workers want to know, does anyone care? Does anyone understand how hard this job is? Why can't we get any respect? In my role as commissioner, I said, we've got to do something that really just sends a really clear message that we do care. And so we started this thing called social worker wellness. It's like, we're gonna, in order to support the workers so they know we care, because the sense was, if we take care of the workers, they'll take better care of the parents, and the parents take better care of the kids. And so we started a thing called social worker wellness. And there's sort of three R's that go with it: respect, reimbursement, and resources. In terms of respect, social workers, and I say social workers, and that's interchangeable because there are some folks who do CPS who aren't social workers, as Barry mentioned. Respect, it's a tough job, but it's a job that takes a lot of skill, a tremendous lot of skill. And as Barry said, you can train people to critical thinking, but you can't say you do A, B, C, D, and E. And I used to go out and talk to social workers when I was commissioner, and they'd just say, just tell us what to do. Just tell us what to do. And they'd say, use your clinical brilliance. That's why you went to school. That's why you got the degrees. I can't tell you what to do in a particular situation because there's a nuance. And one situation looks like it's the same, but it could be different. So it's a tough job. It takes a lot of skill to be able to do it. Folks spend a lot of time getting their education so they can do it well. And folks need the respect that comes along with that. And if we can get our elected officials to give social workers praise, particularly during like Social Worker Month, we used to do thank you luncheons. We do lots of things to let folks know that we appreciate them. Another way to respect social workers is through caseloads. It's very disrespectful to give someone a workload that they can't achieve. And then to come back to them, to be in their face and saying, did you make all your home visits? Did you do all your documentation? Did you do all of your treatment plans? And of course, the answer is going to be no, because there's too many cases. And we know that there's the issue of caseload and workload. Now, I had the opportunity in Massachusetts to reach a historic agreement with our labor partners around reducing our caseloads from 18-1 to 15-1. And it took a lot of work to do that, because of course, if I say, let's go from 18 to 15, they'll say, no, let's take it to 12. So it was a lot of work to get that agreement. But one of the things we did in that was we said, let's recognize that some families actually should get double credit for working for some families, where they may have 5 kids in foster care, or they just may be really complicated. So we we struck a deal, and that's probably how we're able to close the deal, that we actually, for particular families, they would count double. Another way to respect social workers is to pass the Social Worker Safety Act. We need to have a national Social Worker Safety Act. It's absolutely critical. Now, we were able to pass the Social Worker Safety Act in Massachusetts, and one of the things that helped us do that was that there had been legislation filed at the federal level, so we actually could leverage that to get that done. New Jersey had a bill that went to Governor Christie recently, a Social Worker Safety Act, and he vetoed it. Legislation was filed in Vermont. It didn't make it through. Hopefully this year it will. But we need a national Social Worker Safety Month. So you can say to social workers, we got your back. We know you're going into difficult situations, and we're going to put as many protections in place to help you do your job. We talked a lot about training, coaching, and mentoring. That's a way to respect people. It's disrespectful to throw someone out there in the deep end of the pool and say, good luck, hope you can swim. And then sort of the public awareness, really putting out there the good work that social workers are doing, CPS workers are doing, and that there's good public awareness of the work they're doing. And obviously work conditions. I've gone to places where social workers are working in buildings where the heat doesn't work, the air conditioning doesn't work, the windows are cracked, the plumbing's on and on and on, and then go to places where it's a good, clean, respectful place. And it's just say that the work you do is important, so the conditions in which you work need to be as well. In terms of reimbursement, salaries, I mean, I'm on a mission to make, just about any time you talk to someone, well, I've had a number of social workers I've talked to across the country, and I've been to 40 states in the last 3 years talking to social workers, and I'll invariably will talk to someone who says, when I told my parents I was going to social work, they nearly started crying and said, you're not going to make any money. And then I'll talk to someone else that said, well, I was at a cocktail party and said, I'm in social work, and people said, oh, you don't make any money, poor you. I want to turn that into a myth, that, social workers should get paid, given, it takes just as much time to get your degree, your student loans are just as high, and the work is just as demanding. And really want to change that around our country. If you look at the average social work salary today across the country, it's $46,000. The average teacher salary is around $56,000. Not to pick on teachers, but we need to get those salaries up. At some point, we as social workers need to stop saying, I don't do it for the money. It's like, I do it for the love. I want to get reimbursed because I have a family. I want to take vacations. I want to buy a new suit. I had to take my jacket off the day it got so hot coming over here. But reimbursement, we want to get paid. Things are important like travel reimbursement. When the gas prices go up, the reimbursement for social workers need to go up. In Massachusetts, the Department of Children and Families, we spent over $1 million on travel. So when the gas prices went to $4.25, I'm raising my hand in the governor's office, we need more. They said, well, none of the other commissioners are asking for money for travel. I said, well, none of the other agencies are out in the field as much as we are. And that was one time when within 3 days, we got the increase. It was like shock. And they gave us another dime. I got a little nervous about a year later when the prices went down. I thought, oh God, they're gonna come back and they're gonna ask for that dime. But they didn't. Opportunities for overtime pay. We know doing these jobs is not 9 to 5. People should be reimbursed for overtime pay. There should be early retirement options. We're actually able to get past in Massachusetts that social workers, CPS, child protective social workers, would get 5 years added to their tenure because of the work they did was so difficult, and they could retire 5 years earlier. And that is something we've been working on for 20 years, and we finally got it done. Student loan forgiveness. And there should be opportunities for educational leave programs. I think Barry mentioned it. Some folks come in, maybe they have a BSW or they've got a related degree, but an opportunity for them to go and get a master's degree, an MSW. And we had programs in Massachusetts where the worker would get their full salary, and for those 9 months or 10 months, their job was to go to school and study and pass. And then on the back end of it, they owed us 3 years of of employment, and it worked out well. So we're able to professionalize our workforce. In terms of resources, I should say resources. We need good supervision, good coaching, good mentoring, technology. You know, workers need the technology in their hands to be able to connect to the case records and to get the kind of information they need. We need to be addressing issues of secondary trauma. The work is hard. Imagine if you're the first person on site, a horrific domestic violence where the mother has been murdered and the kids have been in that home with that mother for 3 days, and you're the first person to show up, and you're trying to address the issues of 3 young children under the age of 6, and they've been traumatized. Well, that's real traumatizing for you to be the person that's doing that. And could kind of go on, but really that secondary trauma and those debriefing groups. When we started doing those, it was interesting. One thing we learned was we had to find the grittiest of the social workers, the toughest, convince them that it was okay to come to the debriefing groups. And once we did that, the other workers would come as well. Because we would host the groups, no one would show up. And we said, why ain't anybody showing up? And then we figured out. As social workers, we tend to think we're tough. We think it's a culture of toughness, and we don't want to admit our vulnerabilities and so forth. But once those groups were in place, people had a place where they could talk about the impact that the job was having on them. And that helps reduce the burnout and the tension and the stress. In terms of resources, other things, is a good, effective case practices, a good, effective case practice model. The social worker shouldn't have to be out there making it up all the time. There should be really good case practice models that guide them in their work. Obviously, leadership. Folks need good leadership. If you've got good leadership, whether it's coming from your supervisor, your middle manager, or your assistant commissioners, deputy commissioners, so you can do a good job. And then we need partnerships in the community. The partnerships go across the gamut, whether it's your hospital emergency room, your law enforcement, your private nonprofit agencies, your technical assistance centers. There's so many partnerships you need, in business, foster parents, adoptive parents, to be able to get the job done. And really, I didn't specifically mention it, but leadership from the legislature is so important, whether it's Capitol Hill or Beacon Hill, your local legislature, that you're getting the kind of legislation you need to be able to do the job. And ultimately, we want a good, strong Child Protective Services workforce so we can change the headlines. And I think ultimately, the ultimate headline we want to change, we want to see a headline that reads, America's CPS system thrives after years of struggle. Thank you.